Hello, my name is Tamara Taylor, nurse practitioner student at Herzing University, and today I'm going to perform my physical assessment on WAFAT. Okay, we're going to go ahead and get started. So, hello.
Hi.
How are you?
Good. How are you?
Good. My name is Tamara. I'm going to be your nurse practitioner
Nice
for
to
today.
meet you.
Nice to meet you too. Can you verify your name and date of birth?
My name is Wafat. My date of birth is February 7th, 1996.
Okay, perfect. And can you tell me where you are today?
I'm at the clinic.
All right. And can you tell me the day of the week? What's the date today?
August 15, 2019.
Okay. So right there we are checking her orientation. Okay, so we're going to move along. So what brings you in today?
I have lower back pain.
When did this pain start?
3 days ago because I lifted 2 gallons of water and then after that it started hurting me.
Show me the location if you don't mind.
Right here, lower back.
Okay, so seeing that you're pointing at your lower back. All right, describe the pain to me. How do you describe it?
It's aching.
And is it a constant pain or does it come and go?
It's a constant pain.
Okay.
Constantly.
And on a pain scale, we're going to rate your pain 0 the least and 10 the greatest. How would you rate your pain right now?
I would say 5.
Okay, and what is the aggravating factors?
It's aching me.
Like what makes let me rephrase that. What makes the pain better and what makes the pain worse?
Oh, okay. So what makes the pain worse is if I get up and do any kind of movement. What makes it better is if I sit down or lay down.
Okay, so it seems that the pain is worsened upon exertion. All right. So how does this pain impact your daily life?
It's hard to go to work and to go to school because it hurts when I walk.
Okay, I'm so sorry you're feeling this way. We are going to get you better. I just want to go ahead and review her medical history now. What medications are you currently taking?
None.
None? Okay. And what do you have any allergies?
No, I don't.
All righty. And tell me about your medical history. Do you have any family history? I'm sorry. Let's start off with your medical history.
No, but my dad has hypertension.
Your dad has hypertension?
Yes.
Okay. What about you yourself? Have you had any health issues in the past?
Strep throat.
Okay, strep throat.
In December 2018.
Okay, and so do you smoke?
No.
Do you drink?
No.
Any alcohol use?
No.
Any drug use?
No, ma'am.
Any history of abuse?
No.
And do you exercise every day?
I do.
How many times a week?
3 times a week.
3 times, and do you work?
Yes.
And you're in school? All right. So we are going to now. Oh, let me ask you about your vaccinations. I was checking your chart. It shows that you had your hepatitis, your Tdap, and HPV done last year.
Yes, ma'am.
Okay. And when was your last pap smear?
February 2019.
Okay, so you're not going to be doing until another 3 years. And when did you get your flu shot last year as well?
Yes.
Okay, perfect. All right. So now we're going to begin by doing the assessment. So I'm going to we're going to do a review of systems. And actually just a couple questions. Have you had any chills or fevers lately?
No.
No. Any headaches, dizziness, feeling of vertigo?
No.
Loss of vision, blurred vision?
No.
No. Okay. Any ear pain?
No.
Any congestion, sinus pain, anything going on with your nose, drainage, mucus?
No.
No. Okay. What about your throat? Sore throat, difficulty swallowing foods?
No.
All right. Any chest pain or heart palpitations?
No.
Any shortness of breath?
No.
All right. Have you had any coughing?
No, I haven't.
What about abdomen pain, nausea, vomiting, diarrhea, constipation?
No.
No? Okay. And when was your last bowel movement?
This morning.
Okay. And that's a funny question. What about urination?
I think maybe.
No, I mean not like when did you pee last. I mean, have you had any burning or itchiness in that area? Okay. What about any joint pain?
No.
All right. And how do you feel? Have you been having loss of energy or your energy has been just fine?
It's been fine.
Okay. And how do you feel psychologically? How do you feel?
I feel good.
In general. You feel good? Okay. All right. Any depression, any sadness in your life?
No.
Okay. All right. So now we are going to begin with the assessment of the
Sounds
head.
good.
So the first, I'm just going to take a look at it, just, you know, examine your head. So the hair is equally distributed. She has a, good amount of hair. And I'm going to palpate the scalp. Okay, no nodules noted. All right, we're going to go down here to the occipital. All right. No bulging, no thinning of the hair, no masses, no tenderness. All right, I'm just going to take a look at the skull, the back. All right, so it seems that the skull is symmetrical as well. All righty. So I don't see any lesions. I don't see any rashes in her head. So, okay. So now we are going to look at your face. We're just going to do the assessment. As you can see, it is very symmetrical, both the right and the left side. I'm going to assess the temporal arteries. All right, well, it's better for me to do it this way for me. Alrighty. So no vibration. I feel 2 plus, as expected. All right. So now we're going to do submandibular, the jaw. If you can just, turn over here.
Yes, sure.
Yes. So I can take a good look like this. All right. So we're just going to do the assessment right here. All righty. Do you have any discomfort?
No.
No? Okay. So now I'm going to ask you to open and close your mouth. Again? So that's fine, okay. So I feel no clicking, and I hear no clicking and no popping sound. So that's good. Looks like there's a full range of motion. All right. So now I want to test her cradle nerve number 5, and I'm going to do that by her just biting down. Bite down. All right. I feel it right in there. So that's good. It's intact. Perfect. So now I'm gonna just assess her sinuses. So you can just turn back around like this. So I could do it in the camera, show it's more visible. So I'm just start by palpating. Any tenderness, any pain?
No.
Down to the maxillary. You can just put your head up just a little bit. Any pain? Any tenderness?
No pain.
No. Okay. Perfect. So now I'm going to just test your sensation in your face by asking you to close your eyes, and then I'm going to strike a soft object, and then I'm going to strike a soft object and a sharp object, and you're going to tell me whether it's soft or sharp.
Okay.
Okay. So I'm just going to grab 2 little things I have here. And okay, so I'm just going to use the back of here. All right, so we're going to start off with so close your eyes, and I'm going to start off by striking your forehead. So, you're just going to say sharp or soft?
Soft.
Wait, I'm going to do it one more time. Okay, what is this?
Soft.
It doesn't feel sharp?
Oh no, that one was sharp. The first one was soft.
Okay. Okay, we're going to start over on that part. Okay, so close your eyes one more time. All right. So.
Soft.
All right.
Sharp.
Okay.
Soft. Sharp. Soft. Sharp.
Alrighty. So now we're gonna move along. And we're gonna do another. So, just right now, have you had any? Are you in any pain right now?
No
with your
pain.
face wise? Okay, everything is good. All right. So now we're gonna really do the assessment from top to bottom. We're gonna move along. So we're gonna look at her eyes. Her eyes look symmetric. She has um, we tested her vision when she first came in on the Snellen chart, and her acuity was a 20 out of 20. So first, we are, if you can just turn towards me like this, and I'm going to test her peripheral acuity. So we're going to do this. We're going to start, okay? So you tell me when you can start seeing my hands, okay?
Okay.
All right.
I see it. I see it. I see it. I see it.
Okay. So her peripheral acuity is intact. All right. So now we would test the color discrimination if we had the color book, and she would describe what she saw in the images with different colors. That could help us know if she has any color blindness, or she wouldn't be able to differentiate between one color and the other. But we don't have that book. I just want to explain the process of how it's done. So now we're going to move along, and we're going to test cranial nerve 3, 4, and 6, the extraocular muscles. So we're going to do this by, I'm going to tell her to look at my nose and then follow my finger and not to move her hand. So go ahead. Alright. Just put the camera so you can see. Alright. Perfect. Doing good. All right, so cranial nerve 3, 4, and 6 is intact. Okay, so now I'm going to do the accommodation. You're going to look at my finger and just follow my finger, okay? So you can see, can you look in the camera this way?
Yes.
All right, so you're going to do the same thing, but look at my finger. Okay? So you can see right there the accommodation. Okay, move it along. So now I'm going to tell you to ask you to come back like this, and you're going to stare at this wall forward. Okay? And I am going to, oops, where's my light? Here it goes. So I am going to take a look at her eyes and to look at her pupils to see if they constrict. So you're just going to look at the wall right straight forward. And I will look with my light at both pupils. So just look straight. Don't even move. Yeah, I'm just gonna take a look at your pupils. All right, so both pupils constrict. So that is testing the corneal light reflex. Okay, so the constrict to light. So that's a good thing. Your eyes are intact.
Nice.
Perfect. So the reflection is symmetrical. So now we will, well, actually, if I had the fundoscope to test the eyes, I would be able to visualize her eyes, the interior of the retina and the optic nerve head and the blood vessels to visualize the fundus of the eye. But actually, I don't have that machine, that tool with me, the ophthalmoscope. So we're going to move along to the next assessment. So now, how are you feeling so far?
So far, I'm feeling good.
Okay, so now we're just going to move on to the assessment. We're going to move on to the ears. So first step, I already asked you about your ear. You haven't had no ear pain, right?
No ear pain.
All right, so we're just going to, you can come, you're going to come this way.
Oh, this way?
Okay, yeah, that's fine. You can do this ear first.
Okay.
All right. Perfect. So the first step of examining the ear is inspection. So we're just going to take a look at it. You know, is there any lesions? Is there any drainage? And her no lesions or drainage noted. no discharge. So we're gonna look into the ear canal. I have my otoscope right here. I'm just gonna turn on the light. All right. Technical difficulties. So we're gonna check the ear canal for wax, discharge, inflammation, and we're gonna take a peek at the tympanic membrane. So we're gonna pull it back and all right. So I see the tympanic membrane, no inflammation, and I can see the pearly gray. I do note some earwax cerumen, but that's all. Okay, thank you. So we saw pearly gray and visible of ossicles. Did you have any pain while I did that?
No pain.
Okay, so no tenderness. All right, so we're gonna do the other ear.
Like
You can just
this way.
yeah. All right, so we're gonna go like this, and I'm gonna take a look. I'm gonna hold the ear back, up and back. I'm actually gonna go around this way so I can take a better look. All right, perfect. So we're gonna first examine the ear canal, the external of the ear first of all. There's no drainage, no lesions. We're gonna take a look at the ear canal. Alrighty. No inflammation, pearly gray, that's the ossicle visible. Alright, so it looks good.
Nice.
We'll just go ahead and sit forward again. Alright, perfect. So did you have any pain in that ear when I did that assessment?
No pain.
Alright, perfect. So the next step after we do the visual assessment of the ear, we would test the hearing, of course. So I don't have the Webner, I don't have the tuning fork, so I'm just going to pretend this is the tuning fork and I will explain how the process is done, but I'm not actually going to perform it. So we're going to start off with the Webner test. So that is performed by striking. So we would get the tuning fork like that, strike it, and like that, and then I would put it up here, and I would ask the patient um, where she can hear it better. So this test for sensory hearing loss. So she could either say, I can hear it better in the right side, the left side, or bilaterally. Okay?
Okay.
So we would do tree, and then that test is for the sensory hearing loss. So then we do another test called the Rhine test, and that tests for bone and air conduction. So it's also done with a tuning fork, and we do the same thing, not the same thing, but we also strike the tuning fork like this, and then we put it behind the mastoid point of one ear, like that, and then we ask the patient to let us know when they stop hearing it, and then we don't hold it. I was just holding because her hair is in the way. I strike it, and then here, and then when she says she can't hear it anymore, I put it up like this, towards the ear canal, and I record the length of the sound heard. All right, so now that's just an explanation of how it's performed. I'm going to put this down, and we can do the whisper test now, which I am going to do. So basically, I'm going to tell you a little phrase. I'm going to tell you a phrase, and you're going to tell me. I'm going to close one of your ear canals like this, and you're going to tell me what you hear. Okay?
Okay.
So I'm going to go ahead and close this ear canal like this. All right. I'm going to start, so I'm going to say the phrase.
1, 2, 3.
All right, perfect. And I did say 1, 2, 3. And now we're going to do the same thing on this side. I'm going to close the ear canal. Okay. Well, you can leave your head down. So yeah.
4, 5, 6.
Perfect. Which I did say 4, 5, 6. Alrighty. Okay, so moving along, we are going to inspect you got the ears out of the way, we got your eyes, now we're going to do your nose. So I want you to, you're going to hold one nose like this and
Okay, like this.
and then breathe out. No, do the same nose and breathe. And do the other one. So when we do this test, we are testing for the patency. So it's good. And I'm just going to take a look at your nose, the appearance. Alrighty. Oh, it looks good. It's pink in color. No drainage noted. The next thing I'm going to do is test cranial nerve number 1, actually, and I'm just going to bring something for her to smell. I'm just going to close your eyes for me.
Okay.
And I'm going to bring something, whoops, and you're going to tell me what you smell, okay?
Okay.
All right, so this is testing cranial nerve number 1.
Hot chocolate.
Oh, yes, perfect. So cranial nerve number 1 is intact. That's good. So moving along is the mouth and the throat. So note her lips. She does have some color on it, but it looks moist, pink, no cracks. And now we're going to take a look inside her mouth, okay? So open your mouth for me, please. All right. Upon assessment, the oral mucosa is moist and pink. All right, so now I'm going to take a look at your gums. All right, so the gums are pink and tight. Open your mouth one more time. They fit around the teeth, and the teeth are white. No cavities or caries noted. Do you have any teeth pain?
No.
All right, perfect. So now we're going to inspect the dorsal top of your mouth. And I'm going to look at the top. So we have the hard palate and the soft palate noted, which is ruggedy and pink. So I'm going to now assess your eluva. So, can you say, okay, perfect. And tonsils are not, no enlargements of the tonsils. And the roof of the mouth looks good. The eluva is pink midline. No enlargement of the tonsils, which is normal. And the soft palate rose. It rised when she said ah. And this test is cranial nerves number 9 and 10. So now we are going to test the cranial nerve number 12. So if you can stick out your tongue for me. All right, thank you. And I'm just going to take a look at the tongue. The tongue looks good. And under your tongue, good. I can see the veins. All right. So that is good. And so your mouth, no discomfort. Everything is fine, correct?
Everything is fine. There's no discomfort or there's no any pain.
Okay, perfect. So now we're going to move along. We've got her mouth checked off. Now we're going to do her neck. So first thing I'm going to do is just inspect all over, and it seems upon assessment that her neck is symmetrical. No lumps, no bumps, no lesions, skin is intact, pink, warm. All right. So now I'm going to start by palpating her cervical lymph nodes. Okay, let me see if you can just turn to me like this. Okie dokie. All right. So we're just gonna open this just a little bit. You can just look up. So we're gonna start by, I'm just gonna put my hands and palpate a little bit. Okay, no palpable nodules. All right, now we're gonna do the supravalvular lymph nodes. A little bit over. All right, and no nodules noted. And I'm just gonna do the axillary while we're over here. I just open this. Stick my hands under to the axillary. All right. So no palpable nodules. Everything feels good. Any pain?
No, it just tickles.
Okay. Any tenderness?
No.
So, all right. So I'm just gonna zip that up for you. And now I am going to just let me look at me if you can. Visualize her trachea. It is in midline position. And you said no difficulty swallowing.
Nothing.
Okay.
Yes, ma'am.
All right. So now I'm going to take a look at your corticoid pulse, which is over here. I'll just go here to the camera so we can get a better look. All right, 2+, no thrills. All right, so now I'm going to actually just take my stethoscope and listen to it with the bell side. Yes. Okie dokie. Sounds good. So now we're going to assess cranial nerve number 11, and this is done. This is the accessory nerve. Yes, nerve. And we are going to assess this by moving your neck from side to side and then up and down.
Okay.
So go ahead and just turn all the way to one side. Perfect. And turn all the way to the other side. Perfect. And then move your head up. Perfect. And go all the way down. Perfect. So cranial nerve number 11 is intact. And I'm just going to take a look at the jugular vein. Alrighty. So no distension noted. Okay. Upon assessment. So now I want you to just shrug your shoulders. Shrug up, down, shrug up, down. Okay. Alrighty. Perfect. So now we are going to look at the thyroid. Okay? So we are going to do this. I'm going to give you back your drink, okay? And I just want you to take a sip, but I want you to hold it. Make sure you do not swallow it. And I'm going to palpate your neck, and I'm going to palpate it to see if there's any thyroid enlargement, nodules, irregularities in it, or if there's any tenderness. All right, so go ahead and swallow. All right, so no enlargement of the thyroid. Any pain?
No pain.
Any tenderness? No. Okay.
No.
All right. Okay, so the neck is supple, midline, non-tender. So the assessment of the neck looks good. All right, so now we're going to move it along to the chest and then the lungs. All right. So first, if you can turn around for me, we're going to start off with your back. Back, back, back. All righty. You can actually, yeah, that's fine. Let's move the chair just a little bit like this. Okay. Her shirt is very tight, so I'm just gonna go on top of the shirt. We're going to look at the thoracic case. Looks good. Actually, I can just take a look real quick. Just lift it. Just take a look. All right. So the skin is intact. No lesions, no openings, no abnormalities noted. And I will just put my hand over here to assess the spinous process. Do you feel any pain?
No pain.
No CVA, tenderness. Expansion appears symmetrical. Alrighty. So now I'm going to place my hands on your back, okay? And I'm just going to ask you to say 99.
99?
Yes. And this is testing for the tactile firmness. Okay? Go ahead.
99.
Okay?
99.
Okay?
99.
Okay?
99.
All right, perfect. So that we tested for the tactile firmness. So now I'm going to percuss over her lungs. Oh no, go back. We're not done yet.
Oh, okay.
All right. So I'm gonna put my fingers out like this, and I'm gonna percuss. All right. So I'm just gonna like, okay. Well, my hands are screaming. Can you just direct just a little bit? Of course, this is direct just a little bit. Perfect. Alrighty. And now we're going to listen to the respirations. Okay. So I'm going to ask you to take deep breaths. Breathe in and out. Take a deep breath. Let it out. Perfect. Again. Yeah, go ahead. Yeah, just take the regular breaths, but just deep breaths.
Okay.
Okay? Let it out. Thank you. Deep breath. Let it out. Deep breath. Let it out. And deep breath. Let it out. All right. So in conclusion, respirations are regular, non-labored, no shortness of breath. Skin appeared intact, no lesions. So you can turn back around. No abnormalities, tactile firmness, symmetrical vibrations, no lumps, tenderness. And yeah, now we're gonna move on to the front page. Okay. The front interior of the chest. So now I'm just gonna open this just a little bit so I can get a better place I can put my stethoscope. Okay. So we are going to listen. Okie dokie. So now we are going to, listen to the heart. I will begin by, well, put this back on. listening to your aortic, pulmonic, tricuspid, mitral. We take it from there. So I'm going to start with the heart. Okay, just going to open your sweater a little bit more. And do the herbs point. Okay, and we're just going to move more down her. Okay. S1, S2, noted regular rate and rhythm. No thrills, no heaves. Now we're going to take a listen to the pericardium, which is located in the fifth intercostal space, mid-clavicle line, mid-clavicle line, fifth intercostal space. Right, and that's going to be right over here. As you can see better in the video. The pericardium, just going to feel, and we are typically feeling for the rate, and I feel the normal 2+, the apical pulse of maximum impulse. We would do that by placing the stethoscope and listening for 1 whole minute. So do like this and listen for a whole minute, okay? All right. For this assessment wise, we're not going to listen for the whole entire minute. All right. So we are going to move along. How are you feeling?
I'm feeling good.
Okay, perfect.
So far, so good.
Any discomfort at all?
No discomfort. Everything's fine.
Okay. So the next step is we are going to visualize her abdomen. So by this, I'm just going to readjust the camera real quick and have her get on the table. So just 1 minute. All right. What's that? If you can come on the table for me.
Is this fine?
Yeah. Put your legs down. Come on. Move your hands to the side. We're gonna lift your belly. I'm gonna just lift your this. Sorry for exposing you.
You want to fix the camera?
Yes, I will fix it. And you said your last bowel movement was this morning?
Yes.
All right, so the first thing is appearance of the abdomen. The abdomen appears soft, non-tender, doesn't look distended, okay? Umbilicus, midline. Her belly button is inverted, okay? Umbilicus is inverted. So now I'm going to, the first step before I touched anything was just to visualize, inspect, always. The second step is to auscultate. So I will do that now with my stethoscope. Alrighty, we're going to begin. We're going to begin. All right, just let me know if you have any pain. All right. So the abdomen is going to be in 4 different quadrants. So choop and choop. So we got the right upper quadrant first. Alrighty. Okay. Mhm. Mhm. Perfect. Vowel sounds are present in all 4 quadrants. All right. And now the next step is going to be doing percussion. I'm sorry. Should move this stethoscope. We're going to do the same thing. I'm going to put my hand there. Oh. Our pants must be down. Okay. Okay. Well, we did the percussion. So then we are going to do the palpitation. No lumps, no masses so far. No lumps, no masses. All right. Next, I'm going to do the assessment of her vascular sounds, including her aorta artery. Okay, so that I'm going to use by the bell side of the stethoscope. Put my stethoscope back up. And this is typically located a little higher, like right up here. So I'm going to be listening for a blowing and swishy sound. I'll just fix my stethoscope. You can see in the camera where it's located. Okay, and we listen a little bit lower for the renal artery. In the left side of the renal artery. And then the iliac. All right. Okay. So now I'm going to measure the liver span. So actually, I'm just going to use this pen to do the marking. So liver is on the right side. So then we measure it, and if I had a measuring tape, I would measure it. It should be between 6 to 12, but hers is approximately, it looks like it's 8 centimeters. So now we will measure the spleen on the left side. Okay. And I push it all the way in so I can feel it. All right. I'm going to hold on to the left side. All right. So I can feel the spleen intact. All right, are you okay, little fat? Are you doing okay?
Yes, I'm doing fine, thank you.
All right, so while you're over here, actually, if you can just sit up for me. Oh, actually, while she's sitting here, we are going to assess her femoral pulse, and it's located more down over here. So I am just going to put my hand inside. Well, actually, I'm trying to show on the camera, but it's basically located where the thigh is over here. So actually, she's wearing like, okay, so we were palpating the femoral pulse, the inner thigh. Can't really see that good in the camera, but it's right here located in the inner thigh. All right. And I'm going to rate it as a 2+ in normal. Okay. And also the inguinal nodules. I'm gonna. She has a slightly. If you can slightly flex your knees, slightly. Oh, not that much. Just like slightly, yeah. And I'm gonna assess the nodule. All right. No palpable nodules. Okay, perfect. So now we are going to assess her lower extremities. So as you can see, the skin is symmetric. Oh, well, you cannot see. I can see. You just lift up your legs for a little bit. All right, so the legs, skin is warm, dry, intact. The hair is very lightly, equally distributed. So while we're down here, we're going to assess for the palpable pulse. And also I'm going to note no edema or redness. And the palpable pulse is located behind the knee, which I'll do it on this side so that you can see better in the camera. I'm going to hold from behind. You can see what you can, yeah. All right, perfect. Regular pulse, 2+. And now we're going to, I'm gonna do the posterior tibula. All right here where the, I'll do on this one that you can, well, if you can just lift your leg right here so I can just show in the camera where is it located. All right, perfect, it's 2+ positive. And then we're going to do the dorsal pedis, which is right over here at the front. And of course, while we're doing it in the assessment, I'll be doing it at the same time to compare them, poses, but just assessment-wise, so they both can show on the camera. So the dorsal pedis, okay, +2. So now I just want to assess the plantar and the dorsiflexion. So if you can just point your toes up with that. Yeah, just point them up. And then point them down. Both. Point them both down. Both down. Okay. Well, you can't really see. Try to move the camera a little. Okay, so plantar dorsiflexion is there. And I'm going to assess the strength. So now put your point it up and push against the hands. Yeah. This? Yes. All right. Perfect. And then do the other one. Push down. Oh, down. All right. So strength equally distributed. And she's strong. She got strength in her legs. So now I'm just going to put these down. And we're going to do the range of motion, the muscle strength, okay? So if you can just sit up for me with that. And I'm going to ask her to squeeze my hands. So squeeze my hand. All right, perfect. I'm testing for strength. And I'm going to test the epitropal nodules inside of the elbow. All righty. Good. Feel for the nodule. All right, I'm feeling the other hand as well. Yes, ma'am. All right, perfect. So now with that, if you can just stand for me, come down off the table and stand for me right over here.
Right here?
Yes.
Okay.
So now I'm going to do the assessment of her movement. So first you're going to do shoulder, we're going to assess for shoulder flexion, which is basically like this.
Okay.
And you're going to do it in both arms. I'm just going to adjust the camera. Okay, go ahead. Okay, perfect. All right, so flexion is good. Now you're going to do extension, which is to like that, the down. All right, perfect. So now we're going to do abduction and adduction. So move your hands like that and then back down. Abduction, adduction. Again, abduction, adduction. Perfect. So now we're going to do the internal rotation and external rotation. So like this and then like this. External rotation, internal rotation. Sorry. Go ahead. External rotation, go ahead. And then the internal rotation. Okay, perfect. And then we will do the horizontal rotation, which is basically like this. If you can do that. All right.
Like this?
Yes, perfect. All right. Any pain, any discomfort? Are you feeling okay?
Yes, everything is great.
Okay, perfect. So now we're just going to move along. And while you're standing, because it gives us a good view on the camera, I'm just going to hand you something in your hand, and you're going to describe to me what you feel. And this is testing for the steragonus. All right, close your eyes. All right, open your hand. What do you feel in your hand?
Feels like a pencil.
Okay, perfect. And that's exactly what it is. So now we're going to do the sensation exam. So we're going to do the face, the arms, the hands, the legs, and the feet, okay? So I'm going to bring a sharp object and a soft object. All right, you can close your eyes. So I'm going to do the same thing basically. I'm going to scrape around your hand. You're going to tell me is it sharp or soft, okay? So we already did the face earlier. So now we're going to do the arms, okay? You just tell me what does it feel like?
Sharp.
All right.
Soft.
All right.
Sharp.
Did you feel it?
Soft.
All right. Let me see your other hand. All right. Close your eyes.
Sharp. Soft. Soft. Sharp.
Okay. So then we did the arms and the hands, and I'm just gonna do her legs. I should have done it when she was on the table, but I'm just gonna go down and then do her legs. Oh yeah, that's perfect. Yes, thank you. All right. Tell me if it's sharp or soft.
Sharp.
Oh, but you probably can't feel through your pants. Yeah. Okay.
Sharp. Soft. Sharp. Soft.
All right, and we're going to do the other one too.
Sharp.
Close your eyes.
Sharp.
All right.
Soft. Soft.
Okay, perfect. So her sensations are intact. So now we are actually, we're going to do the Babinski reflex, and I'm trying to think of a way it would be best to do that. Can you put your feet back on the table, just the feet? All right. Can you do like this? All right. Take off my foot real fast. Okay. So I'm going to do the Babinski reflex by doing the assessment by putting the object and seeing her legs curl in. Okay. So yes, perfect. If you can see the curling, her legs curl, her toes curled in, fanned in, perfect, and that's what we're looking for. Okay. So it is a negative Babinski. So next thing we're gonna do is we're gonna do the position sense. So because you have your feet out, I'm gonna start out with your feet. So close your eyes and you're gonna tell me which position I'm moving your toe. Is it gonna be up or down? Okay.
Okay.
Your toe.
Down. Up. Down. Down. Up. Up.
Perfect. Okay. All right. We're done with that, and we're gonna do your other toe, if you don't mind. If you can bring your other toe up here. Normally we'll have her on the table, but just for presentation purposes, I want it to be a better visual, and this works better because we're doing it on the computer. All right. Tell me if you're going up or down, and close your eyes.
Down. Down. Up. Up. Down.
Okay. Perfect. Go ahead and put your shoes on. All right, so now we are going to do the cerebellum function test, and you are going to, I'm going to explain this to you by, you are going to touch my finger, then touch your nose.
Okay, so put your finger.
Oh wait, the camera can't see.
Oh.
Hold on.
Okay.
So you're going to touch my finger and then your nose, and then my finger, then your nose. Okay, perfect. And that is the position. I'm so sorry. That is the cerebellum function test. So now, if you can just take a seat. Okay, we're going to do the heel to shin test. Okay, so let me explain this to you. We're going to take the heel of one foot and then you're going to rub it against your other foot. Just like this.
Okay.
Just like this. But just go back if you don't mind so I can bring the camera so I can show you.
Okay. So like this. Like this.
Okay, just do one time. Okay, then do the other one. Okay, perfect. So I am going to assess for reflexes now. Okay, so if you can just come closer if you don't mind. And you can take a seat, and I'm just gonna if you can come closer to the camera so we can do your reflexes. All right, so basically we're gonna do your, first I've got my hammer out, and we're gonna do your brachial pulse. I feel it right there. Okay, I'm gonna hit it from here. And we are going to, what we want to have is the contraction of the bicep and the relaxation of the forearm. Okay, so I'm going to feel for it first. Like this. Yeah, I can feel it right there. Okay. All right, we had a little move right there. Okay, perfect. And now we're going to do the triceps. So, which is like the back of the arm. So we're gonna have a little dangle like that. All right. Just put your hand like this. Yeah. Okay. All right. I'm gonna hold my hands. All right. Okie dokie. And one more time. All right. And for we can do the other one. We're gonna do the same thing here. Just feel for it. There we go. Perfect. Back of the arm to the tricep. Okay, perfect. So now we are going to do the brachioradialis, where the radial pulse over here is. All right, we're going to do the same thing. Here, right over here. Okay. Okay, perfect. So now we're going to do the patellar oculus. So that is going to be where the knee is. So we're going to bring the, if you can go back. All right, more back. Okay. I'm going to go down. Go more. Like this. Okay. All right, actually we can leave this on. Okay. Go ahead, and I'm going to strike. I'm just going to like relax, let relax. Okay. All right. All right, the camera can see us. Okay. Okay. So you got a little jerking there. Okay, do it again. Do the other one. I'm sorry, I know it hurts. I know I hate doing it myself. Okay. And we're gonna do now the oculus, which is the back of the ankle. I mean back of the foot. And try to bring the camera down as much as I can. Okay. And then we're gonna do that. Can you lift your legs? I can just show. Where's okay? Yeah. All right, and this one. Okay, dokie. Oops. Just gonna adjust the camera for a second. Oh. So now we are going to do some test on your walking. Walking? This is stuck. Okay. Now open the camera back up. Big. Okay. Still recording. Okay. So, move this chair out the way. Alrighty. Miss Wafat, could you please walk across the room for me? Walk again. Sorry. Now walk on your heels, on the back of your foot. Walk on your heels. Like this? Yes, walk all the way in your heels. Yes, all the way across the room. Perfect. And when you walk back, I want you to walk on your tippy toes. Good. Then I want you to walk from your heels to your toes, like this. The heels, well, where you're at, I'll show on the camera. But with your heels to your toes. Yes. Perfect. Good job. And then you're gonna come back over here. And we are gonna do the rumbar sign. Rumbar sign. So come a little bit closer. All right. So you're gonna bring your arms. You're gonna put your feet together. As you can see, her feet is together. And now you're going to bring your arms out in front of you. In front of you. Perfect. We do it in front of you. All righty. And I just want you to close your eyes. All right, close your eyes. Okay, and would your eyes close? Sorry, open. Okay, that is a negative break sign, so perfect, that's what we want, as expected. So now we will do the shallow knee bend. So with that, bend down all the way to, bend your knees all the way down, like you're doing a squat.
Okay, like this?
Yes, now come back up, and I want you to do it by standing on like only one foot and try to go down. Not to squat, just to like bend down and do it on one. Okay. Okay, perfect. And do the other one. Perfect. And now I want you, we're going to do range of motion of your spine. Okay. So, arms by side. Put your arms by your side.
Up and down.
Yes. Arms by your side, and then lead side, and then the other side. Can you do that for me?
And then that side.
Yes. And then bend forward for me. And then perfect. And then bend backward for me, and put your hands on the back, on your thighs. Yeah, perfect. I know your back is hurting you, so we're not going to ask you to go all the way down. Okay, perfect. Now, you're going to sit back down. Sit back down for me, and I'm just going to discuss with you a few more things. All right. So, what the plan? So our physical assessment is completed. I don't know if we did this during the assessment. I just want to go over that the radial pulse we did take and the brachial pulse we did take. Okay. Perfect. So now, Miss Wafat, I want you. This is the plan we're going to do about your back pain. So I want you to take ibuprofen 600 milligrams every 6 to 8 hours as needed for pain. And you're going to take the ibuprofen. Make sure you take it with food. Okay?
Okay.
All right.
Sounds good.
So you're going to do that for 2 weeks. Okay? I want you to do lower back exercises. I'm going to print you out some handouts, and you're going to take it home with you. So you're going to do some lower back exercises to help with that pain. I want you to continue being active. Don't just like lay around. Try to be more active. You can use heat and ice. Switch it out. Alternate between heat and ice 3 to 4 times a day. And I don't want you to carry any heavy objects that are heavier than 10 pounds. Okay?
Okay.
And if this pain is still consistent and it's not going away, we will probably most likely refer you to the physical therapy. But this is the plan for the next 2 weeks, okay?
Sounds good.
And I want you to follow up with your primary provider.
Okay, sounds good.
Perfect. And I just wanted to make sure that you do have the resources for healthcare. You said I checked in your chart, you have sliding scale. Okay, perfect. So your sliding scale is covered for your office visits and for specialties, correct?
Yes, ma'am.
Okay, perfect. So you don't have any issues with receiving health care, that's correct?
Yes, correct.
Okay, so you're insured and you're good, all right. Because if you did, then I would provide you with some resources. I would help you with that.
Okay.
Okay, well, thank you so much for letting me perform my assessment.
Thank you so much.
All righty.